Welcome to the Explainer. Today, we're going to look at how a tiny $30 gadget could be the answer to a massive, and I mean massive, invisible health crisis. So let's get right into it. Take a look at this. It's a simple, home-built device, but it's designed to solve a problem that is enormous and almost completely hidden from view. Now, I know it might just look like a piece of tech, but as you're about to see, what it's trying to do is tackle a genuine life-or-death issue. So, first things first, let's meet the device at the heart of our story today. This is not something you can just go out and buy in a store. Nope. It's a do-it-yourself smart pill dispenser, and it was created to be like a little personal health assistant right there in your home. And how it works? Well, it's just brilliantly simple. So, step 1, you schedule your meds in an app and pop them in the dispenser. Then, step 2, when it's time, the device gives you a buzz and a little message on the screen. And finally, step 3, you press one big friendly button, and bam, the correct pill drops right into a cup. The whole idea is to take all the guesswork and stress out of managing your medication. Okay, so we've got this clever little device, but why? Why does it even need to exist? Well, it turns out it's a solution to a truly staggering global health crisis, one that most of us never even see.
This one number, it says everything. The World Health Organization estimates that 50% of all patients with chronic illnesses don't take their medications the way they're supposed to. There's a technical term for this. It's called medication non-adherence, and its consequences are just enormous.
And just look at how widespread this is. Doesn't matter if we're talking about high blood pressure, glaucoma, or asthma, study after study shows that a huge chunk of patients really struggle to follow their treatment plan. So this isn't some kind of niche issue. It cuts across pretty much every single field of medicine. So the obvious question is why? Why are so many people missing their medication? And as you probably guessed, the reasons are incredibly complex. It goes way, way beyond just simple forgetfulness. To help us get our heads around this complexity, the World Health Organization actually has a really helpful framework. They've identified 5 key areas or dimensions that are all interconnected and influence whether or not someone takes their medicine the way they should. And these dimensions, they cover a lot of ground. You know, it could be socioeconomic, like can you even afford the prescription? It could be the healthcare system itself. You have a rush doctor's appointment, you leave feeling totally confused. It might be related to the condition. If your high blood pressure doesn't have any symptoms, you might not feel that urgency to treat it. The therapy itself could be the issue. Maybe it's a super complex schedule of multiple pills. And then finally, yes, of course, it can be patient-related, like just plain old forgetfulness. And when we really zero in on what predicts this, you start to see a clear picture. It's this mix of really practical things, like a complicated pill schedule, and psychological things, like being afraid of side effects or just not believing the treatment is doing any good. It really is this tangled web of interconnected challenges. And this is where we circle back to technology. We know tech can help, but just building a device is not enough. For it to actually work, especially for older users who are often juggling multiple medications, the design has to be absolutely impeccable. A recent study on smart home tech for the elderly shows us exactly what matters most. It draws this really critical line between a confusing design and an effective one. And it turns out the things that seem small, like font size or getting clear feedback that your button press actually did something, they're not small at all. They're monumental. In fact, when researchers crunched the numbers, 3 factors had, by far, the biggest impact on whether users were satisfied. Number 1 was clear information on the screen. Number 2 was getting feedback on your actions. And number 3 was font size. See, this isn't just an opinion. This is data telling us what makes technology truly usable for people. All right, so let's bring this all together. How does all this research connect back to that simple little DIY dispenser we started with? This, my friends, is where the story comes full circle. Remember the interface on that device? It has a single large button that lights up. It has a vibrant, clear screen that gives you real-time feedback, confirming that yes, your pill is on its way. It is the exact opposite of a confusing, complicated interface. So you see, this isn't just some fun gadget. It's a perfect example of applying evidence-based, human-centered design. The very things the research told us were crucial, clear feedback, simplicity, they are built into the very core of this device. It just goes to show you that you don't solve a problem with more tech. You solve it by better understanding the people who have that problem. So here's the real takeaway. The best technology isn't about more features or more complexity. It's about a deep, thoughtful understanding of the people it's supposed to serve. This little dispenser proves that truly powerful innovation can be simple, it can be clear,
And it can be designed with empathy. Which kind of makes you wonder, doesn't it? What's the next big, invisible problem out there that a little bit of thoughtful tech could solve?